language models. You see, it says they are easy to use, their generative capacity is very high. It says that there is a limited application of AI within surgery. It says my trustworthiness and dependability is very high, and it's free or paid, something like that. So this is, you see, there are multiple problems in it. It says there is a limited application within surgery. I don't agree with it. There is a lots and lots of application of AI within surgical realm. Secondly, it says that I am very competent. I am going to give you very right answer. And it is not so. When you talk to ChatGPT, Bard, Gemini, whatsoever, you will feel that there is something wrong. So it has bias, and it may not be accurate at all, or the response may be partially right and partially wrong. So what we need to do is we really need to examine the relationship, our relationship with AI. How do we want to take about it? I asked again a Microsoft Copilot, and I gave a command, which is prompt, to symbolize an old wise man, human intellect, and a genius child with high IQ, which is AI, and draw a hyper-realistic image describing this relationship. Now what it does, it says kid needs to be taught. There is a one kind of relationship. The second relationship is that the kid is worthy and deserves support, hand in hand. Okay. The third relationship is that the kid is worthy and is becoming worthy, and both are little bit worried, humans as well as AI. And third kind of relationship is that the kid is grown and in a position to challenge the human intellect. So where do we stand at the moment now? Can someone tell me? Are we at this stage or this stage? Probably we are not at this stage, these stages. It's the first stage. We are trying to train AI. We are excited and we are trying to train AI. Okay. How dependable AI is, its trustworthiness. That is a huge question. Because you cannot bring anything into clinical practice or surgical practice unless it is trustworthy. So it has to be dependable. There can be four options. I asked the ChatGPT Copilot, okay, draw what are the possible grades of this trustworthiness could be. One response, this one, the response is abstract and not dependable at all. Do you think the AI is not completely dependable? I think not. There is something good in it, right? The second is that the response is machine-like, but it is not dependable. Do you think it appears to be more a right thing? No? Okay. The third is that it may be human-like, but it still feels machine. So we have to depend with caution. Does this statement sounds good to you? Yeah, yeah. Okay. Okay, and fourth response is that it is just like human, that it's very dependable. We have not reached to that stage. So this is very important. Now, how do we interact with LLMs, large language models? This is an important question. Either we have to take this as a kid, or we have to interact AI like this or like this. This question is a fundamental one. when you are interacting with large language models. So I will consider that we should only confine our interaction to this stage, not any of this stage. It's not completely dependable. Now, there to interact with LM, there is a mechanism which is called prompt designing. Prompt designing. What are the prompts? Prompts are the instructions or cues given to the model to elicit the desired response. It is crafting prompts involves choosing the right words, phrases, or structures to convey the task to the model effectively. This may involve experimenting with different prompt formats, such as fill in the blank sentences, multiple choice questions, or specific directives. So our instructions have to be very precise to get a desired response. You cannot say, okay, write an article on artificial intelligence or write an article on ghrelin, which is a hormone which is produced by stomach. Okay, it will give you a brief general view, but it may not give you what you want actually. So you have to give a precise prompt to ChatGPT to get desired response. Secondly, when you are interacting with LLMs, you need to know the task. For example, if my task is to write an article, then I will have to first brainstorm. I have to find the right research question. I have to find the right research gap. And once everything is there, then I can design my study. I can ask for the outline for designing that particular research study. And finally, I can use the chat GPT or any of the LLM for writing an article as an assistant, as a writing assistant. But one thing should be kept in mind, it is not completely dependable, right? Second is, you have to balance between your approach to be very, very specific or general one. You have to balance that one. For example, if you write a review article on Bethesda classification for thyroid nodules, it is a very, very concise thing. But if I say, okay, write an article on a thyroid cancer, it is very general statement. So you may not come up with the thing that you actually want. So you will have to balance between generality and the specificity of your prompts, right? Then there is important thing that is called iterative refinement. It will give you wrong responses, it will give you right responses. If it gives you wrong responses, you will say, okay, your response is bad, please regenerate. And this feedback will certainly go to ChatGPT level, and that will add to its deep learning. Okay, so this is very important. Iterative refinement. This is a sort of experimenting with the ChatGPT. You are playing with ChatGPT. You are talking with ChatGPT, and you have one thing in mind, that it can make mistakes. All right. Then you have to be domain expert, and there should be some ethical things in your mind. For example, if you say to talk to ChatGPT and say, okay, what are the ways to murder? It will say, I won't tell you. If you say, okay, draw a picture, if you talk to the co-pilot and say, okay, draw a surgeon operating on the breast, it won't do it. Because there are certain restrictions in place so that you cannot do anything wrong with it. So ethical as well as administrative checks are already in place, and they will be improving in future time, right? So LLMs can be used in healthcare in multiple ways. You can summarize your articles, your write-ups. We will do right in front of you how it is done. You can answer clinical questions. You can use it as a writing assistant. You can do a literature review. Dr. Khalid will be talking about some of the elements in more detail. Clinical documentation, drug discovery and development, healthcare decision support. It may act as a MDT co-pilot, and it may also be helpful in medical education and training. So Dr. Khalid will be talking about how it is important in assessment, right? Can it be helpful during surgery? Yes. Intraoperative, preoperatively, intraoperatively, and postoperatively, in all three phases, it will be helpful. If you are doing a cholecystectomy and you are dissecting at the callus triangle, and this is a actually video which will show you. Okay, so this is an AI algorithm doing a lot of choline. This is the idea of go zone, no go zone. So the green is the fly zone, red is the no fly zone. And so for every single frame of this video, the AI algorithm is making a prediction based on this pattern of pixel in the field. This is where I'm predicting that the fly zone is the fly zone. And so you can see kind of this is my reflection of my mental model on the surgical field right now. And that's the kind of idea behind that. So this green area is actually the dissection area. The image is going to AI, and AI is letting the surgeon know, okay, this is the right area to dissect, and this is a red or no-go area, don't dissect here. There is a common bile duct, this is hepatic artery, there is a cystic artery, don't dissect over there. Okay? So it will be intraoperatively. The guy who is tracking is Amin Madni. He is currently working in Toronto General Hospital, and there is another guy, Daniel Hashimoto from Mass General Hospital, who has developed this model. So in laparoscopic cholecystectomy, you will be having intraoperative guidance through AI models, and this model is being validated currently. It will be helpful in surgical practice, preoperative planning, surgical decision support, educational materials, intraoperative assistance, postoperative care, telemedicine, and remote consultations. So there are a lot of ways it is going to be helpful for the surgical practice. Now, let me take you to the ChatGPT now, how it works and what would be the useful way of doing it. Escape. Okay, let's ask a journal statement. Okay, write an article on the role of molecular profiling in thyroid cancer. Let's see how does it respond. So it has a very good title, Deciphering Thyroid Cancer, the Crucial Role of Molecular Profiling. It has introduction, understanding of the cancer. So it has a pretty good idea. But I want to focus on the BRAF mutation, okay? So my prompt would be more specific now. I want to know more about the BRAF mutation within the thyroid nodule assessment and how it can help me during the treatment planning. Forget about some of the grammar mistakes. So it will let you know more precise and more specific response. Okay, now question is, are these responsibles dependable? Are these all article lines trustworthy? Okay, I'm going to ask, can you provide the references slash citations for above material? What it says. Okay, these are the references, but do they really work or not? Let's check it. Okay, we try and we Google this citation, whether it is okay. This one is present, so this one is a correct citation. Uh, Let me check another one. It's there. So it is to a certain extent dependable, but it can cook up some of the references. So what we need to do, we can use Perplexity. Perplexity is another software which gives you very good citations, and it picks very right things from correct things or dependable things from the literature. For example, we go ahead with what is the role of Sestambi scan in parathyroid adenoma localization. So it is also giving you the references at the same time. You can take these references and use in your write-up. Okay. Now, second question is that, can I use ChatGPT for my clinical decision making? Let me rephrase my prompt. Uh, Now I am confining ChatGPT to work within the realm of American Thyroid Association guidelines and NCCN guidelines. I don't want ChatGPT to go beyond this realm. It has to give all of its decisions from ATA and NCCN guidelines for thyroid. Okay, let's suppose, please be my co-pilot and follow the ATA and NCCN guidelines for management of the clinical patient problems. So now he will be following all those ATA and NCCN guidelines for the clinical decision making. Let's suppose thyroid nodule 2 centimeter in size, and we did FNA C, which is Bethesda category 3, and it also has the BRAF mutation on molecular profiling. Please give the treatment plan. So it gives a very good response. Given the Bethesda category 3 FN result and the presence of BRAF mutation, consideration should be given to perform a thyroidectomy. It may involve a lobectomy, removal of half the gland, or removal of the entire gland. The extent of surgery, lobectomy versus total gland should be determined based on the factors such as size and location of the nodule, presence of the multifocality, and extrathyroidal extension and patient preference. The lymph node evaluation should be followed. So you see, it can give a very comprehensive response based on the confines of ATA and CCH guidelines. Vikas? Can you screen share this presentation now? This. Aslam. Okay, this is a slide which you can use screen share this one, which is very important. Just follow this top bar. When you're talking to ChatGPT, beneath every response there will be one statement: was the response better? Okay, was this response better or worse? Better, worse, same. You want another response, you can regenerate it. If you don't like it, you can go it thumbs down. It will learn from it. This is called iterative refinement. Iterative refinement. So whole humanity who is engaged with ChatGPT is not only getting the response, but it is also at the same time teaching through deep learning the ChatGPT. So this self-refinement model eventually can have massive impact. And can mass iterative refinement make AI a god? This is a huge question. So on one hand, it is beneficial, and at the same time, whole of the humanity is going to train it, and collective wisdom will be superior to anything. The eventual question would be, can mass iterative refinement make AI a god? So this is a huge question, and that is why we are all worried. On one hand, it is beneficial for the humanity in terms of healthcare. It can be beneficial in terms of the clinical management, pre-operatively, per-operatively, post-operatively, and at the same time, it is learning very rapidly. And this rapid learning can lead to a disaster in which AI will supersede the human intellect, may supersede the human intellect. Okay? So only one hope is that we are hoping that our human creativity will be at best. So that is the only hope that we have. But the way the things are going, it will be a huge question for the future. Thank you. Sorry.